Hello, everyone. My name is Scott Moore, and I am the AAA's HR and operations consultant, just doing a quick take on vaccinations. As many of you know, back in May, Ben Wasman and I, the committee chair for the Workforce Committee, did a quick take on vaccinations and some of the easing restrictions surrounding COVID. Well, since that time, of course, we were talking about vaccinations. The vaccinations first released really in early January, February. Since that time, as of yesterday, nearly 165 million folks in the US have received the vaccination, 58% of the population. Another 192 have had at least one shot. Now, what we've seen, and it's all over the news, of course, the Delta variant. And this is, I believe, as of just a couple of days ago, the latest infection rates from around the country for those who have been diagnosed with COVID-19. Listening to a story yesterday, and I forget what part of the country it was, but one of the Department of Health talking and saying that actually the hospitalization rate right now is roughly the same as it was this time last year. So when you take a look at the side-by-side of not just the vaccination rates around the country, but then the infection rates, I think if we overlaid this map, you would see that by and large, the infection rates are, and it's no surprise to anybody, really tied to those that have not gotten vaccinated. And I know in my community just yesterday, they announced in my county that they are reinstituting a mandatory mask order anytime you are indoors, anywhere at all times. So we are heading back in, unfortunately, in the wrong direction. So what tons of member questions have come up, and what I've seen, and we've seen this now just a few months ago, the city of San Francisco announced that they were going to be mandating all city employees to be vaccinated. I think roughly 40,000 employees. Yesterday, the governor of Massachusetts came out and said that by October, all long-term care or nursing home employees must be vaccinated, had to get vaccinated if they wanted to continue working in the long-term care space. And we've been seeing it all over the healthcare spectrum, as well as in other businesses. Now, of course, this really, I think it was this week, I think I got 10 questions from members around the country that say, hey, we are finally considering, based upon what we're seeing around the country, we're considering mandating the vaccination. Now, a lot of people had been holding up on mandating the vaccination until the FDA had released a full authorization, so got off of that emergency use authorization for the vaccines. And word has it, although nothing formal, what we're hearing is that there is an all court press on getting those vaccination, or getting that final authorization for the vaccination done, so that really for those people who are waiting for the full release or authorization of any of those vaccinations, if that's the thing that's holding them up, they're trying to get that done. So I've been getting tons of questions. Geez, we're going to start to implement this. What can we do, or what should we be considering? And so I thought it would make sense just to jump on and just do another quick take to walk people through it. So first and foremost, can you mandate it? This question is long since answered. The EEOC has consistently said, and this has been held up by federal courts, that employers may mandate the vaccination as of right now. They do not have to wait for the emergency use authorization to become a final authorization. Now, that being said, despite this, we are seeing really shockingly low levels of full vaccination in EMS and public safety. I'm not really sure why. I can understand some on the municipal side where it might be a collective bargaining issue. However, I don't understand, and this is not a union, non-union issue. In fact, if it's for the good and health of not only the workers in the workplace, but also the public at large, this should not be a collective bargaining issue. In fact, it should just be good common sense. So for a lot of folks, what I've been getting is, geez, we've been holding off mandating because what are we going to do if people just flat out leave us? And I recognize that, given the workforce shortage that has been plaguing all EMS and public safety agencies around the country, I recognize that there may be people who, for whatever reason, feel so strongly about the vaccination that they're willing to quit your organization and go somewhere else. And I don't have an answer for that. What I will say is, I think the strongest thing that you can do for folks is to try and seek to understand why it is that they're not getting vaccinated. Because for some people, for example, my brother-in-law said, early on that he was holding off. He wasn't going to get vaccinated, When I got to the root cause, it was he passes out when he gets needles. He was waiting for the single shot Johnson & Johnson so that he didn't pass out twice, but he had planned on getting it. So really do yourself a favor, start, and really work on an education campaign, because there really isn't, for some folks are going to defy logic no matter what you do. But if you use logic and facts, right, remember that we employ a bunch of medical professionals, people who have been looking to science and medicine for their whole career on how to treat people. And so we should try and reconnect the disconnect that's occurred when it comes to their own health. Now, the other thing that a lot of folks and I'm telling a lot of people to do is, listen, everyone has their own trusted medical professional, their own doctor that they use, or most do. Direct people towards their own physician and ask them to consult their physician and learn what the risks associated are. Because I think I said this in a prior QuickTake. The risks of a serious negative interaction as a result of the vaccination is 1 to 3 in 1 million. The risks of being struck by lightning are 1 in 750,000. And by the way, the risks of being born with 6 fingers or 6 toes, 1 in 500. So for all of your people that if you don't know anybody with 6 fingers and 6 toes, and even if you know one, then the likelihood of you having a serious negative reaction as a result of that vaccination are so small that you should move right past that and go get vaccinated, not only for your health, but then for the health of those people around. Now, the question, can you mandate the vaccination? The answer is largely yes. There are really 2 exceptions to that rule. One is if you can mandate it if it's job related and consistent with business necessity, which of course, in this instance, as healthcare providers, it is. Now, the 2 exceptions, if I have an ADA medical claim or medical condition for which being vaccinated would risk my health, then I can be provided potentially an accommodation as a result of that. The other instance is if I have if becoming vaccinated is against my sincerely held religious beliefs. Now, it's important to recognize that not just with vaccinations, but with any time that you have someone who might have a sincerely held religious belief or an ADA protected medical condition, you need to make sure that your supervisors are aware that that individual doesn't necessarily have to come forward. That was sort of the old days. Now, if we have reason to believe that someone may need an accommodation that would allow them to perform the essential functions of the job, then we need to engage that individual in what's called the interactive process. So for those people who come forward and say, as a result of my medical condition, I can't get the vaccination, what I suggest are, number one, as you know, we released the HR manual last year, this past year, and what was included this year that hadn't been in years is a whole bunch of sample forms that you can just simply plug your logo into and make them your own. And so on the left-hand side, there is the 3-page form for requesting a medical ADA accommodation. This is a form you'd give to the employee, and you'd ask them to complete this form. In there are the request maybe for some information from the employee's physician. So this would be where you might say, geez, take this to your doctor, tell them that, we're mandating the vaccination and that you, because of your medical condition, are looking for an exception from that. And one, this will get your employee who may think that they have something that the vaccination says they shouldn't get, the condition that the vaccination would be contraindicated for them. And their physician may say, oh, no, you should get it. In fact, with your condition, you probably should have it more so. But so you can, in that form for the reasonable accommodation is some information that you can seek from a physician. What I would say is in many states, or in several states, not many, there's a requirement that you document that interactive process. And that interactive process is a dialogue between you and the employee to try and determine, is there a reasonable accommodation, not just any accommodation, but a reasonable accommodation that I can provide to you that would allow you to perform the essential functions of the job. And a reasonable accommodation is one which doesn't involve great expense or great difficulty. Now, when it comes to vaccination, that accommodation may be, okay, well, if you're not going to get vaccinated, you must wear an N95 100% of the time, except for when you're eating. And when you're eating, or you're unmasked because you're eating, you need to be at least 6 feet away from others and, to the extent possible with barriers. So you want to document this process. This is the process that shows the EEOC or whatever the state level agency that enforces the Title VII in your state, the state level agencies, it shows them that you went through this interactive dialogue to try and come to consensus with this employee. Now, if in fact there isn't a reasonable accommodation you could provide, even with the accommodation, they couldn't perform the essential functions of the job, well, then you're not required to go through that, but you have to demonstrate that. The important thing is you want to be consistent. And again, train your supervisors to be watching out for that. So the other instance in which someone might object to getting the vaccination will be those who assert that they have a sincerely held religious belief. Now, I will tell you that the Supreme Court and the EEOC interpret what is a sincerely held religious belief very, very broadly. So it's important for an employer to, when again, I have created a form that you should have the employees fill out, and you should use that interactive process form to document that. Because if the EEOC contacts you, or if they contact you because somebody claimed that you discriminated against them on religion, you can furnish all of this information, and you're showing the EEOC and whoever the judge or magistrate is that we have a process. This isn't willy-nilly. We don't just take these things lightly. We have a process. We follow that process. We engage this employee. We tried to accommodate them, but maybe we just couldn't, and here's the basis upon which we didn't think we could. Now, what I've heard from several are, we have a lot of people that claim I have a religious exemption. Now, what I will tell you in my research, and I've been researching this for a while, that there have been no churches that have officially opposed vaccinations in general, and very few that actually discourage them. So it's important to know that the Pope has actually had the vaccine. And so it recognized that there are not that many religions that actually oppose. But that being said, it's not required that the employee's religion be one that's broadly recognized. Now, that being said, again, if the employer has some objective basis for questioning whether that religious belief is in fact sincere, or whether this is not in keeping with the practice of that religion, then they can seek additional information. But you can't, just because the person asserted that they have a religious belief, you can't say, well, you need to produce a piece of paper from your minister, priest, rabbi, or other religious official. Okay, so it's really important you recognize you shouldn't really be seeking that unless you have some objective basis to doubt that. So for example, people who say my religion says I can't get vaccinations, but you have verification that they received the flu vax last flu season. All right, so just recognize that most of the vaccinations, all right, we're not really, are not in a position, or we're not created in an environment that used human tissue, for example. They were using other animal-based tissue or biological material. So for the most part, there really shouldn't be a lot of religious objectors. But for those, as again, what I say is make sure that you have a document, that you ask that employee to document that, and on top of that, you use that accommodation process form. It's the same process form for the medical one. You just want to make sure that you're documenting the system. The process needs to be consistent. You need to document that interactive process. And then again, making sure that if you do provide someone an accommodation, that person doesn't, end up being retaliated against or something else. Now, I've had a few people say, geez, if you make me wear a mask 100% of the time, you're disclosing my protected medical or religious my religious belief, which, by the way, you do have an obligation to maintain confidentiality. However, forcing someone to wear a mask, which is the thing by the way, OSHA says you have to create a safe work environment, or one that's free from known hazards. Here's what I'll say. Sometimes our employees don't wear seatbelts. Sometimes our employees don't wear gloves or stick needles into the bench seat, which I hope doesn't happen. However, we have an obligation to protect our employees even when they don't want to protect themselves, or when they're being careless. So it is not disclosing someone's protected religious or medical condition if you make them wear a mask, because plenty of people are wearing masks again, whether they're vaccinated or not. So one of the things I've been asked is, can I incentivize people? And the answer is, you certainly can incentivize folks. The EEOC came out with some guidance relative to incentivizing people. And what they've said is, provided you've made the accommodations for those with religious beliefs or disabilities. Now, they haven't touched on what you do for incentives, because there really isn't a way to provide an incentive to someone who gets a religious accommodation and doesn't have to get the thing that you've incentivized people to do. They haven't come out on guidance with that. And what I would suggest to you is talk to your local council and find out what your local council has to say. That being said, you want to be cautious, because if in fact you are doing pre-vaccination questionnaires, most people are sending their people somewhere to get the vaccination. That's the best practice, because you're letting the contractor actually get the medical questionnaire and keep that information that you don't want. You just want to make sure that the medical information is kept confidential, number one. And then number two, that you're not seeking any information broader than is required to get the vaccination. So you want to be careful not to be implicating the Genetic Information and Non-Discrimination Act. So you want to make sure, though, whatever the incentive is, the one guidance that the one thing that the EOC did say is it can't be so substantial that it's actually coercive, which is sort of the intent of an incentive, is to be coercive, right? It's to convince people that they should get the vaccination. What they're saying is it shouldn't be so substantial that it's become coercive and functionally penalizes those who don't do it. Now, what I've heard, and there's been no hard and fast number, is roughly $500 would be okay. All right, but just recognize that there is no solid guidance on exactly what amount is too much. It's very similar to what amount is too much for wellness plans. So there is some guidance around wellness plans as well. So it's really important. I know that this was a little bit not so quick take, but lots of questions around vaccinations, mandating vaccinations, and how you can handle those instances in which people are objecting based on religious or medical. Now, by the way, those are the two objections. Really, outside of that, there isn't an objection. So if you have questions, make sure you email info@ambulance.org. And certainly I will probably get those questions, or they'll be funneled to me, or you can email me directly, smoore@mooreemsconsulting.com. And with that, we'll see you at the next Quick Take.